Is that on video? Or pause?
We apologize for the slight interruption. There was a problem with the ophthalmoscope, but now it's working. And so we're going to proceed with the visual and the examination of the fundus. Okay, if you will look ahead and look up there for me, please. Okay. And we're going to check the other eye. Look straight ahead for me, please. Okay. I can see the retina, and the red reflects from the retina at this time. So the next thing that we're going to do is go ahead and check his visual acuity. So I need you to put this, I've already cleaned it.
Okay.
I need you to cover your right eye, please. And you're going to read this card for me, and I want you to read this line for me if you can see it. Hold on, let me get you some light. Okay, there you are. Okay, you want to read this line for me, please?
6.
And this line is starting with the 20, let's see, we're going to do the 20-25 line first.
So it's going to be 3, 7, 4, 2, 5, 8, and looks like a backwards E,
Mhm.
W, backwards E, X, X, 0, 5, 2.
Exactly. Okay, we're not going to go any further with that eye because he actually read the 20-25 line. You want to switch eyes for me, please? Okay, and you're going to read the same line for me, if you can see it, and if not, we'll go to the next line.
The 20, which one?
You're going to read the 20-25 line, if you can see it.
Okay, it's going to be 9, 3, 7, 8, 2, 6, W, W, M, E, X, 0, 0, where that's 2 O's,
Mhm.
4, 1.
Okay, very good. So, Brandon, you're reading, your vision, your visual acuity seems to be fine at this time. Now what I need to do is assess your cranial nerves, all right? So what I want you to do is look at me. I want you to smile, okay? I want you to make a bad face, okay? I want you to, okay, clench down, okay? Push down with your eyes, that's it. Okay, great. Okay, all right, that's very good. All right, next, no, I want you to make some fat cheeks. Very good. Okay, now close your eyes. You can undo your cheeks, close your eyes, and tell me if you feel my hand and what side.
Right side,
Okay, and now?
the forehead,
Okay, and?
left side.
Okay, very good. All right, so he did very well with that. So I've already checked and assessed his cranial nerves. And at this time, I'm going to do a confrontation test, and this is going to be most likely the last one we're going to do with his eyes. I want you to look towards me, okay, and I want you to follow my fingers, okay? Now, do not move your head, okay? Good. And at this time, I'm checking for any abnormal movement of the eyes, any rapid movement, any nystagmus. Okay, very good. And then the last one I'm going to do is keep your fingers and eyes focused on me, and I'm looking at convergence. Just follow my fingers. That's good. Okay, very good. Okay, thank you very much. All right, so at this time, we're going to perform. We haven't done so already. We're going to go ahead and I've looked at the ears and I've assessed it. I need to do the test to make sure that he has good hearing. All right, so what we're going to do first is the Weber test, and with that, Brandon, I'm going to hit this, give it a sound, and place it here. You're going to tell me when you no longer hear the sound.
Okay.
Okay, when you can no longer feel and hear anything. Okay, ready? Hear it in both ears?
No longer.
Can you now hear it?
I hear it.
Okay, you hear it.
I hear it.
Okay, very good. Okay, the next one, we're going to check for conductive hearing. And we're going to do the same thing, except that I'm going to put it here on the mastoid process, you're going to tell me when you no longer hear it, and then I'm going to move it to here and you let me know if you still hear it. And this is determined if air conduction is greater than bone conduction. All right, you ready? Okay.
Mm-hmm. No.
Okay, can you hear it?
Mm-hmm.
Okay, super. And we're going to do the same thing with the right ear.
Okay. No longer here.
Can you hear it?
Mm-hmm.
Okay. And the last thing I'm going to do, and I've already taken and looked visually at the nasopharynx. Now I'm going to use this to open up a little bit just to make sure that we can see. Switching heads. That's good. Okay. And very good. Okay, all of these instruments will be sterilized and cleaned prior to any other additional use by someone else. All right? Okay. Now, I could do the whisper test, but I have already assessed for his conductive hearing loss, if he has any. And right now, he has shown no deficits in his hearing and in his sensory neural for his hearing. I've also looked at his mouth and his lips. And the only thing that we haven't checked for was any fasciculation. So if you would just open your mouth and stick out your tongue for me. Okay. Okay. All right, you can close it. And I've already assessed his posterior pharynx. So at this time, I am going to check for his cervical nodes. And I'm just going to feel here, starting with the posterior and following the chain. Any discomfort, any pain? I do not feel any shoddy nodes. The tonsillar node area is slightly enlarged, but it's more nodal. Okay, I guess he's ticklish, so I'm sorry about that. And I'm also going to check here for supraclavicular nodes to make sure there are none. Infraclavicular nodes, and I feel none. And also at this time, I'm going to check for any axillary nodes. Okay. Okay, and I feel none. And I think we have a ticklish patient here. Okay. All right, so we're going to continue this assessment. I am going to now assess his chest. And I'm going to also listen for sounds of any bruise at the carotid area after I listen to his heart and his lungs. Okay? So at this time, I'm going to assess for the pulmonary artery, the aortic area, tricuspid,